As with all joints that become worn out with age or damaged through injury, arthritis can be a very major problem for the shoulder. If one has a painful and stiff shoulder, then we cannot reach out with our affected arm, and reaching is the primary purpose of the arm, the upper limb. So if we can't reach, we can't interact with our world. We can't dress easily, we can't manage our domestic activities, we might not be able to reach out in terms of things like shopping and laundry and sport and so on and so forth. And it may come a point where the stiff, painful, slightly deformed shoulder can become sufficiently intrusive to warrant having a replacement. Now, that's not as common as hip and knee replacement, of course, but something like 8,000 shoulder replacements are performed in the United Kingdom every year now. So it's becoming more widely respected as a means of dealing with arthritis. So a replacement of the shoulder involves replacing the damaged surfaces of the ball and the socket with new materials fixed into the bone. And there are lots of ways of doing that. But by and large, it's replacing the surface of the socket with something that's made out of a very high quality polyethylene fixed to the socket itself. And on the other side, on the ball, something like a metal or a ceramic hemispherical replacement of the ball itself, and again fixed into the bone of the upper arm in various ways. So somebody who has a stiff, painful shoulder that's intrusively disabled, and particularly if they are troubled at night, could qualify for a shoulder replacement. It's now been well established as a good treatment for shoulder arthritis. Shoulder replacement is a major operation. It's not as challenging for the body as hip and knee replacement, but it's nevertheless an important operation. It takes me about 2 hours to do a straightforward shoulder replacement. And for that, I need the excellent help of anaesthetists who can give a good general anaesthetic, which is quite light because we always use what's called a nerve block to numb the shoulder and the arm, so that the pain messages of the surgery do not get through to the awareness centers in the brain, but we can still give a light anaesthetic. So you wake up comfortable and reasonably quickly. We perform the surgery usually through the front of the shoulder, through a cut down the front about 10 to 12 centimeters long, and we divide very, very carefully the muscles of the arm and the chest, but only one muscle is actually cut, and that's at the front of the shoulder. That gives us an entry into the shoulder, and there are lots of extremely useful tools and instruments to perform the replacement of the surfaces very accurately with high precision. And then the muscle at the front of the shoulder is then repaired, and it's that which we need to protect early after the operation as you start to recover from the procedure. So afterwards, you'll be in a sling, because that helps to both support and protect the arm at the shoulder, but then we ask you to do very simple exercises. These are designed to make sure the muscles don't go fully to sleep, that the shoulder starts to glide, but always within the limits of the discomfort that you might have. And that then starts the process of rehabilitation of the arm into your day-to-day life. The most important benefit of shoulder replacement surgery is pain relief. What my patients tell me is that nearly universally they say the pain of the arthritis has disappeared. And I'm glad to say it appears that that's true even within a few hours on the next day after waking up from the operation. Clearly, people have surgical pain, but they know that that is different from the pain of the arthritis. So the most important benefit is pain relief. But if the muscles around the shoulder are in good health, and we care for that one muscle at the front, which I have to divide to do the operation accurately, then the potential benefit is also an improvement in the range of movement, and with that, an improvement in strength, and with improved strength, we get better endurance, so the arm then becomes less fatigued. And the most important concept for me is that we don't normally think about our shoulder and elbow when we are doing things in real life. We attend to our hand and what our hand is doing in front of us, and the shoulder and the elbow simply do what the hand needs to do to satisfy our interest in our environment. So the shoulder replacement takes away the intrusive pain and disability from our engagement with our world. And so people very nicely come back at somewhere between 6 and 12 months after surgery saying that they have forgotten their shoulder. The shoulder is no longer influencing how they behave in their world. So shoulder replacement can liberate someone from the disability and de-integration of their activity with the world. That's tremendously important and very rewarding to hear. I think of rehabilitation according to the principles of healing. I'm a little bit aware that there are so-called protocols for recovery, and they're based on a knowledge of the healing response to the trauma of surgery. I mentioned a muscle at the front of the shoulder that has to heal in order to provide stability and purpose to the shoulder. That takes about 6 weeks to start to heal reasonably well, and about 3 months before it is really solidly healed. So over that first 3 months, there are limitations as to how far one can reach, how fast and how frequently one can do the exercises designed to restore the movement in the shoulder. So we take it in phases. The first 6 weeks is an inflammatory phase where the shoulder is recovering from the surgery itself. The second 6 weeks is when the muscles are beginning to recuperate and become purposeful and strong again. And then from 3 months to 6 months, we're beginning to build up the ultimate range and ultimate endurance of the shoulder, so that by 6 months, people have said to me, that was worthwhile. It can take a minimum of 3 months to feel that they have stepped forward in their lives, and 6 months before they feel, actually, this was really worthwhile. All the difficulties of the sling and the recovery period are behind me. And then at a year, people say, I have forgotten my shoulder. It is no longer the blight on my life than it would be. So broadly speaking, 6 weeks to personal independence, 3 months to what I call domestic independence, where you can use your hand to reach across a table or a desk, and 6 months to what I call social independence, that is, beginning to be comfortable and confident in the outside world. Now, many people feel that they can get those milestones quicker, and many people do, but I don't emphasize speed. We emphasize the quality of movement rather than the speed of recovery, because we are essentially all on a recovery timeline that has been basically the same for millions of years, and there's no reason to suggest that I can make that any quicker. So we stick to it. It seems reasonable to be quiet and progressive without having to rush things.